Hello again, Marshmallow Warriors. We're back under the stars where Medicare gets decoded and the marshmallows stay golden. Unless you're like me and light them on fire. Today, we're getting alphabetized because if you've ever stared at Medicare Supplement plans A through N and wondered, is this health insurance or Wheel of Fortune? You'll relate to our guest. Please welcome retired high school math teacher and certified logic ninja, Rodney R.J.
Thanks for having me, Kim. I brought my abacus, my notepad, and a deep mistrust of Plan K. I opened the comparison chart and thought I'd landed in a cryptogram puzzle. Plan A, B, C, D... Wait, not that D. Different from the Part D for prescription drugs. So if I picked both, would I now have Medicare D squared? Then there's G, K, L, M, N. I mean, who came up with this? A Scrabble grandmaster?
I know, right? Have you heard this one? If Plan G and Plan N walked into a bar, nobody would pick up the tab because neither covers excess charges.
Good one. That's the most accurate Medicare supplement joke I've heard all year.
Okay, Rodney, how did you actually choose a plan letter?
Well, I know my numbers and letters since I was a wee lad, so I did what I do best. I made a chart, then a second chart comparing the chart, then a third chart comparing both charts. Then I realized my wife already had Plan G and loved it, and that trumped math.
Love always wins, especially when it comes with a low deductible.
Exactly. I almost picked Plan N, lower premium, but the co-pays and risk of excess charges scared me. I don't like surprises, unless they involve birthday cake or tax refunds.
And what about the infamous Plan K?
Ooh, Plan K. It was like a group project where I still had to do 50% of the work. I respect it for trying, but if I'm going to pay half the cost sharing, I at least want to pick the snacks.
All right, we've covered letters. Let's talk numbers. How's Plan G working for you financially?
Honestly, not too shabby. Premium's a bit higher than some of the other plans, sure, but it's predictable, and that's a high priority for me. I'd rather pay the same higher fixed cost each month than unpredictable co-pays each time I go to the doctor or hospital. With my Plan G, I paid my Part B deductible on one visit to the ER, and now my doctor visits are basically like showing up at a spa with a prepaid gift card. Love it.
Wait, you get cucumbers on your eyes at the cardiologist?
No, but I don't get billed afterwards, which is almost as relaxing.
Ever tempted to switch plans?
Not really. I know what I'm getting. There's no network, no referrals, no surprise banana peels. It's not exciting, but at 70, I like boring and reliable. I like oatmeal and C-SPAN.
If you could give one tip to a new Medicare enrollee thinking about adding a Medicare supplement plan, what would it be?
Easy. Pick the plan that fits your peace of mind, not just your wallet. If you don't like dealing with unexpected bills, plans G or N are strong. If you're okay with sharing costs to save premiums, look at K or L, but read the fine print. And if anyone tries to sell you plan C or F now, run. That ship sailed years ago, and it took the free buffet with it.
Rodney, it's been a pleasure. Next time, bring that abacus. I'll let you do my taxes.
Only if you roast me another marshmallow first.
Rodney R.J., folks, cracking alphabets and taking names. That's a wrap for today. Until next time, remember to stay warm, stay toasty, and stay up to date on all your Medicare alphabets.